Radiation therapy has been around for decades treating patients with breast cancer. But what we have found, looking back over the course of those decades, is that women who got radiation treatment for left-sided breast cancer, unfortunately, ended up having a little bit of their heart exposed to radiation. And so that has led to people wondering, is there ways to minimize that radiation dose to the heart? And the answer is, yeah, there are a few different technologies that can be used. And one of those technologies is a technique of delivering radiation with a deep inspiration breath hold, otherwise known as DIBH. And what we basically are doing is coaching the patient to take a deep breath of air in, fill their lungs with air, and from there, that air that fills the lungs is actually pushing the heart away from the chest surface, which is pushing it away from the breast treatment. And so as long as a lady can hold her breath for about 10 to 15 seconds, we deliver the radiation, the heart gets very little dose, and the incidence of heart complications decades down the line is negligible. In the old ways of doing this type of technique, we literally just asked the lady, take a deep breath in and hold it, and we just assumed things would line up. Things have gotten a lot more scientific. But we now have sensors that are in the room that take a model of the surface of the patient that shows the topography like a map. So the body's contour is mapped out. When a lady takes a deep breath of air in, that contour changes. So we want to make sure that every time they take that deep breath of air in, the contoured map of the surface is matching what we've planned out. And so let's say a patient takes their deep breath of air in and suddenly can't hold their breath. Our machine is connected so that instantaneously the beam of radiation turns off. One of the big reasons I decided I wanted to come to Tanner is the commitment Tanner has to patient care as it relates to our cancer patients. From the 3-day program where we commit ourselves to getting a patient treatment options within 3 days of their diagnosis, to something like this, where it took a lot of effort to implement this technology, but Tanner was committed to it and without hesitation allowed us to provide this service to our patients.